Hi, I'm Aya Kamaya from Stanford, and I'm here with Justin Shea, also from Stanford, and we are here to tell you about our paper that was just published in this month's AJR journal. And the title of our paper is Outcomes of LI-RADS Ultrasound 2 Subthreshold Observations Detected on Surveillance Ultrasound. So Justin is the first author of this paper. We also have Lu Yao Shen, who is here. She is our camera person. We also have Kristen Bird and Luke Yoon, who are co-authors, not here today. And I'm the senior author. And we're recording this in front of our beautiful cactus garden at Stanford on this warm, late November day. Okay, so Justin, so congratulations on this paper. Can you tell us a little bit of background about how sub-centimeter observations are managed on screening and surveillance ultrasound examinations in patients who are at risk for development of HCC?
So the way in which these sub-centimeter observations are managed typically depends on where you live. So in the United States, the recommendation right now is to follow these at 3 to 6 months intervals, as opposed to just 6 months intervals for a period of 2 years. In Europe, it is also a shorter interval at 4 months for a total of 1 year, and in Asia, it's immediate CT or MRI.
Okay, great. So if it's stable after the end of 2 years, at least by ultrasound LI-RADS and also AASLD, then that observation can then be considered to be benign, at least currently. So what was the purpose of our study?
So we found that a lot of these recommendations are based on expert opinion, but this question of what happens at imaging follow-up is a relatively unexplored question, and so we want to answer it with our data set.
Okay, and so what did we find?
So we followed all patients at Stanford who had an ultrasound 2 observation detected at screening surveillance ultrasound, and we broke down our results into 2 parts. For patients who had ultrasound follow-up, none of these observations grew beyond 10 millimeters. In other words, they did not progress from an ultrasound 2 to an ultrasound 3 observation. Another set of patients had CT and MRI during their course of follow-up. And the majority of these patients, about 3/4, did not have a correlate. In other words, this observation could not be re-identified. And then the remaining quarter of the patients, these were found to be an LI-RADS 1 or 2 observation, very rarely in LI-RADS 3. Most commonly, these represented either cysts or hemangiomas.
Okay, great. So essentially these ultrasound 2 observations, we did not see these turning into HCC. It still does not mean that they don't need to go on to surveillance, but that surveillance is important. And we did have some findings in some of the patients that did have HCC. Can you tell us a little bit about that?
Yeah, so we found that 8 patients did develop hepatocellular carcinoma, but that these hepatocellular carcinomas were completely unrelated to their initial ultrasound 2 observation. So the implications of our study is that ultrasound 2 observations do not necessarily become HCC. However, they're still at risk for HCC, but that these HCCs do not originate from a sub-centimeter observation. So ultrasound screening and surveillance still remains important, but in terms of follow-up for the sub-centimeter observations, prolonged observation at short intervals may not necessarily be as important.
Okay, great. Thank you so much. We hope that you enjoy our paper in AJR, and please let us know if you have any questions.
Great, thank you.
Oh.